A 65 years old Asian female present with extracapsular neck of the femur fracture, and investigation shows calcium level 2.07 which is reduced, phosphate level 0.66 which is reduced, and alkaline phosphatase which is 2.256 which is increased. So what is the most likely diagnosis? Here are the options: bone tuberculosis, hypoparathyroidism, myeloma, osteomalacia. So first of all, let's see the bone. Here is the normal bone and appearance of the normal appearance of the bone. On the other hand, there is the osteomalacia, and this is the feature of the osteomalacia. And in case of normal Hendley bone, here we can see this bone marrow, they are compacted, they are trabecula well differentiated, there are different type of the matrix present. But in case of the osteomalacia, here we can see the trabecula is thinning, there is becoming big hole, and the calcium phosphate content are less. So the osteomalacia, what is it cause? The cause is the reduced mineral content. And osteomalacia, when it is occurs in children, it is known as the rickets, and in the adult it is the osteomalacia. What are the types? The vitamin D deficiency or causes of the osteomalacia, they are the vitamin D deficiency. It occurs due to malabsorption, lack of sunlight, diet, from the renal failure, drug induced anticonvulsant, vitamin D resistance, such as the inherited resistance to vitamin D, also the liver disease. So they are the causes of the osteomalacia. In osteomalacia, there is bone pain, fracture, muscle tenderness, and proximal myopathy develop. So in case of osteomalacia, there is a bone pain, fracture, muscle tenderness, and proximal myopathy develop. And what are the investigation? The investigation are usually there is calcium level low, phosphate low, and vitamin D low. On the other hand, there is rich alkaline phosphatase. So when there is the mineral content, all the mineral content low, and there is increased alkaline phosphatase, in this condition the diagnosis is the osteomalacia. And in case of children, there is definitive changes such as the cupped, ragged metaphyseal surface, and in the adult there is a translucent band or looser zone or pseudo fracture present. And what is the treatment? Treatment is the calcium with vitamin D. That means there is the supplement of calcium and supplement of the vitamin D to prevent further osteoporosis and treatment of the osteomalacia. So the lab finding of the osteomalacia is there is low calcium, low phosphate, low vitamin D, and increased alkaline phosphatase. So our answer is the osteomalacia. Other option here such as the bone tuberculosis, it is not true, because in bone tuberculosis there has a role of the ESR. So ESR or ESR usually increase, and there is other features such as there is fever, weight loss, anorexia. So these are the absent from here. And hypoparathyroidism, it is also not true. Myeloma, not true. So only true option is the osteomalacia.